Hello, this is Dr. Naim again, your favorite OBGYN. A lot of patients ask me what is the best way to take care of their C-section wound. In the United States, about 30% of the births on the first baby is a C-section. The closure of the skin is either done by sutures that get absorbed, by special staples that also get absorbed, or stainless staples that last longer, and certain patients might qualify for either or. Regardless, usually these staples are removed within 3 to 4 days, and the sutures get dissolved within 3 to 6 weeks. There is sometimes chance of opening up the wound, which is something that we don't want to happen, but it can happen. We don't want to get infected. Occasionally, patients need to go antibiotics, but a lot of times there's a fluid collected under the skin called seroma, and this fluid can eventually open the skin and can cause like dehiscence or opening of the incisions. Hopefully it's small, sometimes it's bigger. If that happens, we need to let the incision to close by itself. You cannot suture them back because it can cause more problems, and the incision has to close from the below to come and close on the top. Sometimes we put certain packings inside the incision to absorb these fluids and let it close slowly. Sometimes it can close within a couple of days, sometimes it can take up to a month to close. Occasionally these can get infected, and occasionally patient might need IV antibiotic and be admitted to the hospital. But most of the time you don't have these problems, and the incision closes by itself within 3-4 days, and no complication in the long term. For the patients who do have a heavy setting and some of the skin overlaps, you have to keep the area between the overlap skin dry. A lot of times we can see there is a smell or there is a discharge on the skin from the fact that there is no oxygen going there, so you want to have that area oxygen and clean. Sometimes clean with hydrogen peroxide and dry it. Keeping it dry is the main factor that will help to let it heal quicker.